All right, I'm going to talk about the lower respiratory tract. So we're talking essentially deep down into the lungs at this point. So the trachea leads to two major branches called bronchi, and those two branches are referred to as primary bronchi. And then the primary bronchi will each branch to produce secondary bronchi, which will each branch to produce tertiary bronchi. And finally, at the ends of those tertiary bronchi, you would find the small tubes called bronchioles. So here we've got several views of the lungs. Essentially, your lungs are a network of tunnels or tubes, all of those bronchi. Look at the image to the right. That would be what the inside of the bronchi would look like if you were to fill them with a resin or a plaster. So that's almost like an internal plaster cast image of the lungs that you're seeing there. I like that image because it shows you just how dramatic the surface area is within the lungs. If you were to take each one of those little tubes and cut them open and flatten them out, you could have enough surface area to cover an entire tennis court. So your lungs have an amazing amount of surface area thanks to all those tiny, tiny bronchioles. If you look at the image on the left, you'll notice the structure of the lungs, which you will learn about in lab as well. The right lung has 3 lobes, superior, middle, and inferior, while the left lobe has 2 lungs, superior and inferior. All right, at the tips of all of those bronchioles are alveoli. And technically there's little structures called alveolar ducts, which then lead to the alveoli themselves. Alveole means small cavity, and that's what they are. They're little sacs, little hollow cavities, and each alveolus is surrounded by capillaries. All right, within an alveolus you find several different types of cells. So you find type 1 cells, also called squamous cells, and they are the ones that form the wall of the alveolus. So they are your alveolar epithelial cells, and their function is to be thin. That's what squamous means, right? It's flat, and that allows for gas exchange across their membranes. Type 2 cells, also called great cells or surfactant cells, produce a very important substance called surfactant. Surfactant is similar to soap. Its properties allow you to disrupt the hydrogen bonds between water molecules to reduce surface tension. Surface tension is that skin that forms across the surface of a watery area. So for example, if you do a belly flop in the pool, it hurts. That's surface tension. And we don't want surface tension inside of our lungs because it'll make it difficult for us to open up our lungs. The surface tension would have a tendency to cause our lungs to collapse, because it's a very strong force, surface tension. So what we do is we add a soap-like material called surfactant, thanks to those alveolar type 2 cells. They make surfactant, which breaks down the surface tension of the water within your lungs, and that makes it nice and easy for you to inhale and exhale without risk of your lungs collapsing. We also have macrophages in our lungs. They're called dust cells or alveolar macrophages. And you already learned about macrophages in the immune system. They're all about phagocytizing pathogens to help protect your lungs in this case.